Well, dear friends, it's time for us to move on to the lumbar. When is the next video about the lumbar, you ask? Finally, it appeared on your screens. It's time. And in today's video about the Quadratus Lumborum muscle, we will start this series about the lumbar department of the spine. We will go into detail about all the muscles that are involved in stabilizing the lumbar section of the spine. We will go into detail about all the exercises. And let's start with the Quadratus Lumborum muscle. The Quadratus Lumborum muscle has several attachment points. The first is the 12th rib. It attaches to the 12th rib above, and below it attaches to the iliac crest. And its first direction of fibers is like this, from the 12th rib to the iliac crest. In this way, the muscle is positioned from top to bottom. And these fibers, they work at the moment when you lean forward and bend back. Or they also participate in the lateral tilt. When you lean like this, right now my right quadratus lumborum muscle is tense. The left one is relaxed. Meanwhile, my right quadratus lumborum and oblique abdominal muscles are tense. In this way, these blue fibers go from the pubic bone to the 12th rib. These fibers marked in blue are leading down and up and down. And this movement is a lateral tilt and a forward-backward movement. That is, this muscle participates in them. In these two movements, the forward tilt and the side tilt. The second group of fibers goes from the transverse processes of all 5 lumbar vertebrae to the 12th rib. This is the second direction of the fibers. As you can see, as you might guess, these fibers participate in the rotation. When any muscle contracts, it brings its ends closer together. A rotation occurs. Relative to the axis, when these oblique fibers are strained, that is, we start to see that. We also start to see that the abdomen, not just the rectus abdominis and oblique muscles, but also the oblique fibers, together with the oblique muscles, participates in these rotations, and the direction of the fibers changes. And the second direction of fibers. Practically the opposite one. Same thing, from all the transverse processes of the lumbar vertebrae, but already to the iliac bone. And the same, when they are contracted, there is, firstly, a slight inclination in the same direction. And secondly, a rotation. So these two groups of lumbar muscles, they will participate in rotation. In pelvis rotation relative to the rib cage, in these movements, which are just necessary for walking. That is, this rotation should be symmetrical. A small movement should be with each step. But it can't be done when there is a shortening or weakness in at least one group of fibers. Most often, the weakness of the quadriceps muscle of the thigh is accompanied by a change in the position of the 12th rib. Sometimes even by changing the position of the ilium. And it's not uncommon for the opposite side of the weak muscle to be affected. The same quadriceps muscle, but on the opposite side, begins to shorten. And often we see that on one side the quadriceps muscle of the thigh is weak, on the other it's shortened, And for the same reason, a small arc can form. Not as large as with the imbalance of the lumbar muscle, but the formation of such a small scoliotic arc is still possible due to the difference in tone of the quadriceps muscle of the thigh. Because of this, firstly, there will be a limitation of movement. There will be asymmetrical movement during the step. And secondly, very often due to the difference in tone of the right and left quadriceps muscles of the thigh, incorrect movement between the vertebrae will form. The mechanics of movement of the vertebrae or between the vertebral joints will change. And this, in turn, will lead to the formation of hernias, destruction of the disc, and destruction of the joints with the formation of osteoarthritis. Therefore, one of the first things necessary is to restore this muscle when we are dealing with the restoration of the lumbar spine and the pelvis in order to stabilize it. And here it is necessary to simultaneously restore the tone of the weak quadriceps muscle of the lower back and remove the shortening of the short quadriceps muscle of the lower back. This must be done in all three fibers, in all three directions of the fibers. If you leave at least one of the three, after some time everything will repeat, because there will be no optimal mechanics of movements. So you need all three directions of the fiber to work for you, and so that the movement in the lumbar spine was symmetrical. That's why the weaker quadriceps muscle of the lower back. What could be the reasons for weakness? Before you start doing exercises on the quadriceps muscle of the lower back, you need to understand why it is weak and determine which of them is weak. Maybe both are weak, or maybe only one is shortened. One of the most common causes of weakness of the quadriceps muscle of the lower back is a change in the position of the 12th floating rib. The floating rib. That is, it does not attach to the chest, but is located in the thickness of the muscles and can easily change its position in case of any trauma or during a fall. It changes its position, and the position of the muscle attachment points changes. This immediately causes a reaction. If not the whole muscle, then part of the fibers become excluded from the movement. This is the first thing. That is, with a change in the position of the 12th rib, first of all, those parts of the muscles that are attached to this rib will react. This is the direction of the fibers, beige and blue directions of the fibers, leading to the 12th rib. But thanks to the fact that the green direction of the fibers from the iliac bone to the transverse processes is not attached to the 12th rib, it stays the same. It's the same situation that we saw in the neck flexors, where not the whole muscle is immediately turned off because it consists of several parts. Some separate part takes the load on itself, and we see that in this muscle there are simultaneously weak fibers and shortened fibers. Therefore, before doing any exercises, you need to first put everything in order, because you will start to train this part that can take the muscle load on itself. But the other part does not work, and you will get this. You will train only this working part, and the non-working part will remain like it was. It will increase this imbalance. On the contrary, the exercise will even worsen your condition. It would be better to do nothing than do this. Therefore, first of all, we need to establish the reason why it does not work, and eliminate the cause. Then we can do the exercise. In general, the first cause is a change in the position of the 12th rib. The second cause is the same change in the position of the ilium. It will also change the function of the quadriceps of the lower back. Here we can also observe such a thing. For example, when the position of our ilium can change. This is due to the weakness of the gluteus muscle. At the same time, in the back, the ilium can't stay in place and it turns forward. This is the weakness of the middle gluteal muscle, at which the pelvis goes to the side like this. The quadriceps muscle will also react to this. However, there may be multiple options. It can either become shortened from this, or become weak from this. Or it could be the same. Part of the fibers will stop working, and part of the fibers will be shortened. When the gluteus muscle stops working, there may be such a variant that quadriceps femoris would take the load on itself, but this happens rarely. In that situation, the work of the gluteus muscle stops, but the person is able to walk thanks to the quadriceps muscles. That's hardly possible. It can only last a few days. It can only take on gluteus muscles' job for a few days, but it can't be more than that due to such a shortening. Some very traumatic movements might start occurring in the lumbar department. But for some small period of time, when the gluteus muscle doesn't work, it can happen. It can work instead of the gluteal muscle, but not for long. Then it will turn off. It can't compensate this weakness for too long, since it's a huge, powerful muscle. Most often, the flexors or calf muscles start to compensate for it. Piriformis muscle too. But the quadriceps won't be able to do this for long, because most likely a functional block forms somewhere in the lumbar department, and the muscle will turn off quite quickly. It will immediately hurt. However, it is a possibility. It might be reacting to the weakness of the gluteus muscle, maybe even to its shortening. It can also be reacting to the middle gluteus muscle. However, that's rare. It's a rare situation. The next reason for which the whole quadriceps muscle stops working of a part of it is the formation of functional blocks for sprains in the lumbar spine. Between the very vertebrae, it will also turn off some part of fibers, but usually that's not the case. It doesn't usually happen all at once. For example, it can happen between the fourth and fifth lumbar vertebrae, and those fibers that are attached here will stop working. It often happens like this. Together with this muscle, the ligament becomes involved in the process. The ligament that is located here between the transverse processes of the fifth lumbar vertebra and the ilium. Shortening of this ligament often causes compression of the fifth lumbar root. We'll talk about how to fix this too. It should be done simultaneously with the restoration of the quadriceps muscles. That is, these are the most common causes of weakness of the quadriceps muscle of the lumbar region. But we can often see shortening in addition to the weakness. Why does it shorten? Because first of all, the antagonists of this muscle weaken. And during movement, a person does not make the right movements. During some everyday movements, most often walking. During walking, a person does not make those movements during which the muscle will stretch practically to its full length. That is, if we see that there is a shortening of the muscle, this speaks of the fact that there is no particular movement during which the muscle will fully stretch and contract from this position. And why does this happen? This happens primarily when the antagonist of this muscle does not work. The antagonists of this muscle in motion are the oblique muscles of the abdomen, the external on this side, and the internal oblique muscle on the opposite side. The internal oblique muscle of the abdomen. Let's say, for my right rectus abdominis, muscle to fully function, my right oblique muscle, external, and left oblique muscle of the abdomen, internal, must tense simultaneously during a step. And at the same time, this rectus abdominis muscle should stretch and then relax. If this doesn't happen, it will shorten. This is one of the common reasons why the rectus abdominis muscle shortens. These are the most common reasons due to which weakness or shortening of the rectus abdominis muscle develops. How to fix this? How to correct the weakness of the rectus abdominis muscle and shortening? We will talk about this in the next video where we will go through everything in detail. We'll talk about how to determine from which side it is weak, how to determine from which side it is shortened by the volume of movements, how to determine it on your own. It's easier done with the help of a test, but it is impossible to do it yourself. So we will figure out how a person can determine by the volume of movements where his muscles are shortened, where they are weak, and what to do with it later.